Good morning, everyone. This is Dr. Fadi from the Australian Vet, and I would like to talk about the dental issues. It's one of the most common and the biggest issue that I deal with on daily basis. Unfortunately, things become actually more complicated for our pets as their lifestyle becomes similar to ours. As much as we need actually dental care and dental cleaning, so does our pet. So today I'm gonna actually start by showing you Martin, who's actually like one of our cats, that's was dropped off this morning for a dental issue. And we're gonna start with that. I'm gonna show you what's happening actually with little Martin. Martin's here in this cage. Hello, Martin. Good morning, my little man. Hello. Oh, I know, baby, I know. Come here, my little Martin. Come here, my baby boy. Oh, I know, my handsome child. All right. Okay. Now, Martin is a very, happy, healthy cat, and we are very happy with him. We checked him early on, and he's in a top shape. But unfortunately, we found actually that we have a small issue with his teeth. So when we are looking at his gums, oh no, my little man, here we go, my little boy. Okay. When we looked at his teeth, we found actually that his gums, they look a little bit inflamed and a little bit red. And that's similar to us when we have the issue called gingivitis. Gingivitis is a very common problem, whether it's human or animals, if we don't take a good care of those teeth. So we end up having complications that unfortunately in the future might lead to losing their teeth. So unfortunately, Martin here today is because we are gonna do some type of a cleaning of his teeth, and because we have quite a buildup of tartar on his teeth. And we're gonna examine his teeth a little bit closer when he is actually sedated, because we always have some issues with the roots that we discover sometimes during sedation, and we take some little x-rays. Those little x-rays, they show us if the roots have problems in there. So that's the plan with little Martin today. And as you can see, generally, oh no, my little man, come here, my child. I know, baby, I know. There we go. Okay. So as you can see here, Martin is suffering from a very obvious inflammation and reddening, and at the same time, he started to have some gum recession, with his teeth. And this unfortunately might mean that we have to extract those teeth. It's not something that we want to reach to, but unfortunately, little Martin have reached to this stage, sadly enough. And that's why I would like to show today probably what we can do to prevent this problem from reaching to this stage, so Martin is not actually having to lose his teeth. Because unfortunately, Martin is an adult cat, and when he loses those teeth, unfortunately, that means he's not gonna have a replacement for those teeth. Now, if you don't mind, okay, we'll just have actually, yes, thank you very much. All right, so this is, the typical kit that we get actually for the cleaning of the teeth. And this is actually it's a toothbrush, as we can see here. And we have a toothpaste, and there is actually a finger brush that we can put on our fingers. And as you can see here, it's obvious there. Now, we always recommend this type of toothpaste. Reason being is actually it is a flavored type, not like the ones we use for us humans. This flavor, generally like it's chicken or liver or beef flavor, they are actually more acceptable by our pets compared to us. Us, we like this minty flavor. And this minty flavor, unfortunately for them, it's sometimes a bit too much and has some chemicals that we don't want them to swallow it and ingest it. So for this matter, we always, when we start, you have actually to get your cat to accept the concept of having the finger around their mouth and around their face. So what we generally do, like I'm doing right now with Martin, I'm just actually touching and he's accepting me to put my hand around his face. So as you can see, it is really he's accepting that, and he's a sweet cat really. So but you have to be really careful. Some cats do not like this type of thing. So he is absolutely accepting my fingers around his face. Now, the next stage, I would take, a small amount of this, and I will get him to lick this type. So let's go ahead and do that. Now I'm going to show you how we would start actually doing the dental brushing with Martin, because it is one of those important routine. Ideally, we need to brush our cat's teeth like us, something like probably once a day. That would be fantastic. Every 2 days, that's okay. 3 days is as far as we can go. More than that, to be honest, there is no point, because unfortunately during those 72 hours that the plaque turns into tartar, and once it turns into tartar, unfortunately the toothbrush and the toothpaste is not able to do anything. So that's a little bit of a problem for us. So that's why ideally, like I hear some people, they come and ask me and they say like, oh, we take our cat actually, like, or dog, you know, to the dent, like, you know, to the grooming on monthly basis, and we get the, like, you know, the groomer to do that. To be honest, that's not enough. Unfortunately, the groomer, when they do it once a day, it's as good as nothing, to be honest. It just gives it like probably a temporary, like, you know, nicer, like fresh, like, you know, smell to the mouth, but that's about it. But it doesn't really do much to the health and well-being of the teeth. So for this reason today, I'm gonna start actually like by showing you how to do that. Like I say, first thing, we try actually like to get, like, you know, our cat to accept, you know, the hands around the mouth, as you can see here, and I'm touching actually like around the face, and Martin is accepting that. And if you noticed, actually I'm getting Martin, you know, to have his back to me, so that actually when he backs off the table, he's actually having me actually to be that. I'm talking about this at home. You will be doing it very commonly by yourself. You're not gonna have the whole family involved, you know, to help you with that, because it needs to be a routine procedure, and one person should be able to do it on his own or her own. So for this reason, what we're gonna do today, like as you can see, just get actually, because it takes sometimes a week, you know, just to get your cat to accept, you know, like with having the, like the hand, you know, on the face in such a manner. So this is actually something that is really important, you know, just to take it slowly, because if you take it as a rush and you want to do things, you know, all like, you know, fast and quick, unfortunately we are gonna have actually a cat that's not happy, and you might even get injured and have a bite on your finger, because you're putting your mouth, your finger in a very dangerous zone, which is actually like the cat's mouth. So first thing, we tried that. I'm gonna see actually if Martin would appreciate this flavor. Let's see. Hello, Martin. What is that? Yeah, as you can see, Martin seems to have like actually like, you know, this flavor, but not too keen on it that much. Yeah, he seems to enjoy that, but that's not really like, you know, like a very strong response from me. Here we go. What do you think, Martin? No, Martin seems not to like that very much. But the thing is actually, which means we have to find, as you can see, he liked it, but it's not really like very big, like, you know, fan of it. So maybe we have to find another flavor, because this is, you know, to me, that's a liver flavor. Yeah, so it's probably we try next time actually with him actually like chicken flavor. But for like today's purpose, I'm gonna just like, you know, stick to that, you know, concept. Then the next, like, you know, step after I do that, I would just go, I know Martin, I know. I would go actually like sideways, and I would just put, you know, like this on the gums. Here's my good boy. Oh, you're doing so well. Oh, you're brave, Martin. Oh, you're doing so well. Okay, so I'm very happy with that actually. As you can see, that's a starting point. And as you can see, like I managed to put my actually like, you know, to give him to like the paste to start with, put my finger on his gums and rub on the side teeth, because tartar always accumulates on the outer side of the teeth. So we end up actually having this issue, you know, very commonly. So all what we are aiming for is to brush actually the outer side of the teeth for Martin on regular basis. Like I said, I will be like probably like just rubbing this paste, you know, without using any brush or anything for at least maybe 2-3 weeks, you know, till he finds it really comfortable that when I put my finger in his mouth, he's finding it like, oh yeah, he's giving me a very nice treat. So that's what we want. You know, we want that type of relationship, because it's gonna be like working together for a long time. And we don't want it to be like some type of a pressure, because this unfortunately might cause like, you know, either one of us will give up, either because the cat like hates it, I'm not really happy, or we get fed up actually being bit and fighting and getting scratched, you know, like because, you know, my cat is not happy with it, or for the same matter as well dogs. But in fact, you know, dogs are much easier to handle in those situations, and they would accept actually the dental because they like their treats and more of a treat-oriented animals compared to our cats. So now we're gonna go actually like, you know, to the next actually like stage. Then I would use what we call it the finger brush. Where are you going, Martin? Huh? Where are you going? What are you looking over my shoulder? What did you find? Did you see someone there? Okay. We're gonna continue with the same concept. We started with like, you know, how to get our hands near to the face, you know, of my cat. Second stage is to get them to accept having the finger in the mouth. Third stage, we started actually putting the paste on the toothbrush. And all what we do is actually, we don't go for too long. Just to start with, just like this, as you can see, just temporarily, you know, for a little bit. And Martin is being brave today, and he's handling that very well. Well done, my little man. Well done. He's my good boy. He's my good boy. All right, fantastic. So as you can see, it is very doable, and it's not really like, you know, mission impossible. But I have to remind you, by the end of the day, there are so many cases. Some cats, they have quite a strong personality, and sometimes we might not succeed. In those cases, unfortunately, we have to work with certain diets. They are actually dental-based diets that they do contain certain enzymes, and at the same time, they contain actually certain abrasive material. So when the tooth is sinking through that type of kibble, it is hard enough and dry enough that as the tooth is actually going through, it acts like a toothbrush. Unfortunately, like, you know, that's not my favorite plan, but sometimes we have to go into that when we find actually like we are not going anywhere with dental cleaning. So for this, like today, probably like we're done actually with the dental cleaning. So that's why it's very important we ensure that we have the dental health as a top priority, because unfortunately my little Martin here might actually have to go under anesthetic today, because we have to do what we call it a dental extraction and cleaning of the rest of the teeth, because unfortunately his teeth weren't kept in the best of shape. For this reason, you know, probably Martin will be with us, you know, for a day, because we want to make sure that his teeth are all doing very well. Hello, Martin. Okay. Thank you very much. And I'm Dr. Fadi from the Australian Veterinary Hospital, where your pet gets the best health. Thank you.